Welcome, everybody. And thanks for joining us today. Um, I think I know a lot of people are on the call, but just in case, I'm Dana Reed, and I'm the Executive Director of ACNPE, and I'm also a board member of the ANA. And I'm joined by Amy Smith, and I'm sure you all know Amy, but she is a Senior Director of Certifications and Advocacy for the ANA. So today we're going to provide you with an overview of the newly launched accreditation process for supervised practice programs, which is a major milestone for our profession. And whether you manage an SPE program or you're a CNS supervisor or a CNS candidate, we hope you'll come away with a good understanding of the process and get a lot of your questions answered. And so please go ahead, as I'm presenting, if questions come up, just add them to the chat, and we'll have plenty of time afterwards, to go over everything and to answer more. And of course, Amy is here too, so we'll address everything, hopefully. Okay, so let's see. So today, yes, so we're going to explain what is ACNPE, what's accreditation, and how does it benefit our SPE programs and candidates. We're going to talk about two pathways for CNS eligibility for the SPE, and we're going to go over the key steps in the accreditation process for SPE programs and also for CNS candidates. And then we'll give an overview of the accreditation standards for SPE. And then if you're an interested program, we'll go over next steps. And as I said, we'll have plenty of time for questions at the end. Okay, so ACNPE is the Accreditation Council for Nutrition Professional Education. I know that's quite a mouthful, but it was founded in 2015 as the first and only programmatic accrediting agency for master's degree programs in personalized clinical nutrition. And you may or may not understand the difference between programmatic or regional or institutional accreditation, but essentially, they both are providing standards for faculty, curriculum, resources, and administration. And in the case of institutional, it's for the entire university or institution, whereas the programmatic accreditation applies only to the degree program, to a specific degree program. And the overall purpose is to establish a high standard for the knowledge and skills required of advanced nutrition professionals practicing personalized nutrition. And so far to date, we have been accrediting master's degree programs, the actual degree program, but now, we are expanding the scope of accreditation of the SPE program. So I put this chart in just to show where the accreditation process fits in the total ecosystem, and also to compare to the dietetics profession. And accreditation is, a key part of the career pathing for all healthcare professions. And so, with the dietetic profession, so we have a parent or a professional organization, and that's the A&D, the Academy of Dietetics and Nutrition. And in our case, for personalized nutrition, it's the American Nutrition Association. Then there's a certifying body. And in the dietetics field, it's called the Commission on Dietetic Registration, or the CDR. And in our case, it's the Board for Certification of Nutrition Specialists, or BCNS. And those bodies, administer the very important examination and also set the eligibility criteria for the credential. And then we have the accrediting body. And in the case of dietetics, it's the Accreditation Council for Education in Nutrition and Dietetics, or ASCEND. And in our case, it's ACNPE, the Accreditation Council for Nutrition Professional Education. So you can see that there's a difference between a certifying body and an accrediting body. And essentially, the certifying body is certifying individuals for a credential, whereas an accrediting body is accrediting programs. Okay. So why do we need this accreditation for our SPE programs? It offers benefits to both the programs and the candidates that go through the programs. The overall objective is to create a robust experience that's consistent with the didactic and clinical education experience that's provided by the master's degree. And another really important piece is to create opportunities for both candidates and programs. So, what's the benefits for the programs? So any SPE program which goes through the accreditation process, that will be an assurance that there's a high, quality of standards met, and the program itself can be assured that candidates who go through the program have this robust experience, and that enables them to apply into practice what they learned in the didactic setting, and covers all of the CNS required competencies and hours, as well as those required by most states. It also establishes recognition. So candidates know that your program meets these requirements. The public knows, state licensing board knows, employers, other healthcare professionals know that anyone that graduates from this program has a well-defined, high quality of competency. And then very key is that these programs will support the advocacy efforts for state licensure and practice rights in general. And we see this over and over every time we go into negotiate in any given state. And then, of course, it will ease the approval process for national certifying bodies such as the BCNS, and also the state licensing applications. So it just overall, enhances the credibility of our credential, the CNS credential. And now the same applies to candidates, but looking at it from a slightly different lens. Any candidate who completes the program, you will be provided with the structure that you need to secure a robust practice experience, while at the same time allowing the flexibility to meet your career goals. It will give you the tools to apply and practice what you've learned in the didactic setting, and the competencies and hours required by a BCNS and most state licensing boards. It will be an indication to the public, licensing boards, employers, and other healthcare professions that you meet a high level of competency. And it will make it much easier for you when you go to apply, for your CNS credential and for state licensure. So again, overall enhancing the value of your credential. So one important fact is that accreditation is a voluntary process. It's a peer-reviewed voluntary process. So there will always be two pathways to the CNS, as far as this is true for both degree programs and for the practice programs. So you can either complete an ACN accredited SPE program, or you can get your hours under the supervision of a BCNS approved supervisor or supervisors, and in accordance with all the current BCNS criteria. So this is just giving us one new, advantage, one new pathway that candidates can pursue to get this to the CNS. Which programs are eligible for accreditation? Those that are part of a degree program, those affiliated with a university that houses a degree program, or those who are independently owned and operated and not affiliated with a degree program. So basically, any program, will be eligible. Okay. So what are the steps in the process? The first step is that the program will submit an eligibility application for the ACNPE board to approve. And in order to submit the application, you must have candidates enrolled in the program. And then by the time you get further down into the process, before the site evaluation, you must have issued at least letters of completion to at least 10 candidates. But going back, so after your eligibility application is approved, then you will, the program director will participate in a meeting with me to, go over the process and go over how to proceed with the next steps. And then you will complete a self-study report, which basically is a report that shows how you meet all of the ACNPE standards. And then you will host an accreditation site visit, and you notice I have that in parentheses, because not parentheses, but quotes, because most of these we expect will take place remotely. So, we'll do this over Zoom. And the site evaluation team, who, will go through the evaluation process at this site visit, will then submit their findings. They will write a report submitting the findings. And then you as a program will have the opportunity to submit any responses, to the site evaluation report. And then there will be a hearing with the ACNPE board, where questions may be asked, and you will have the opportunity to explain, to answer and to add any other commentary that you would like, to have direct contact with the board, and then the board will issue a decision. So who was the site evaluation team? And, who are these people that are going to be evaluating your program? So we have formed an evaluation pool of about 8 to 10 people. And this pool, is a combination of people of different backgrounds: nutrition educators, administrators, and practitioners. And 2 to 3 individuals will be selected from that pool. And again, the 2 or 3 individuals will be combined, will be both educators and practitioners. So every site team will have at least one educator and one practitioner. And this pool is a group of people who are volunteering, and they are trained by ACNPE to perform the evaluations of both the degree programs, the master's degree programs, and also the SPE programs. So I'd like to give a shout out to the people who volunteered to be part of the accreditation task force for the SPE, and you see their names listed here. And I think I saw that several of them are on the call tonight. They worked very hard and very well over a number of months to develop the accreditation standards. And so how were these standards developed? Well, so looking at that roster that I just showed you, you can see that they were developed with input from a broad range of stakeholders, which is very extremely important. And we did begin with the CNS eligibility requirements and competencies. And we did, keep in mind the various state licensing requirements. So it's sort of a blend. We started out with all of that as a foundation, with the objective to formalize the process and set structure, but also to allow for the flexibility and personality of each program. So the standards are focused on process, and they do allow programs to decide how to best meet the standards based on their, internal objectives. So what's involved in the standards? There are 9 standards. And so I'll just, go through briefly just a little bit about each one. And of course, they're all very well detailed in the accreditation handbook. The first standard is the program mission, goals, and objectives. And of course, those 3 things really lay the foundation to inform program planning, curriculum development activities, and resource allocation, and also provide the basis for assessment. Is the program meeting its goals? And the next is standard 2, the program organization administration. How is the program set up? Are there third-party training, organization sites, and what's the relationship between, the program and those organizations and sites? Standard 3, program personnel. Who's directing or managing the program? Are there more than one? How many supervisors are there? Is there any administration and support? And is it adequate? Is the faculty or the personnel adequate for the size of the program? And then, of course, a very, very important standard, that's the curriculum and the competencies. And those, again, were developed to demonstrate the proficiency of the competencies expected in entry-level practitioner as advanced degree professionals. And they are based on the PN care model. And as I said before, they do reflect all of the CNS competencies and those that are requirements in many state licensing regulations. And then we have program delivery. That has to do with the length of the program, how are the hours allocated, the issue of direct and indirect experience, as well as in-person and telehealth consultations. So there is, I would say there's a fair amount of structure and direction for programs, developing. And next is the program policies. How are legal and ethical issues handled? And that then next, very important part of that is administration and transfer policy. In other words, what process is in place for accepting hours from outside your program. And then next we have program assessment and curriculum improvement. And then candidate assessment. How are candidates measured, and how are the SP hours documented? And how do you evaluate and let candidates know how they're progressing? And then finally, we have program finances. And there we're just looking to make sure that there are sufficient funds to continue the program and meet your goals and objectives. So here is the fee schedule for the next 2 years. And, you'll note that like the total cost of upfront costs are lower in 2014 than they are in 2015. And that's to encourage, encourage everybody to get in step with this process and take advantage of it. And now all these fees would not be due immediately. So they would be due as you go through the process. So it could be that if you sign up, if you submit an eligibility application in 2024, for example, you would only need to pay $250 for the application fee in 2024 because it might be that this self-study report is not ready until 2025, and at which point then you would pay the $1,000 and so on. So again, we tried to be very reasonable in the fee structure to encourage more programs to be part of the process, because that's really how our profession is going to grow. So what are the next steps? Several of you have reached out and asked me for the accreditation handbook, and I provided it. Anyone else here who would like to see it and like to review it, just let me know. And if you have any questions that aren't answered this afternoon, I'm more than happy to set up a time to meet with you and go over your program. And if you're developing, one other thing that I wanted to say, if you are considering developing a new program, or maybe you have a small program and you want to enhance it, knowing what the standards are and working towards those standards. I'm more than happy to help you do that along the way. We're all in this together. We're trying to grow our profession and create more nutrition professionals who can go out and do their thing and change the world. So